Hold on. Go.
My name's Jessica Schneider, and I'm doing my speech today on euthanasia.
No, hold on. Tell your name.
Oh, Rhonda Cross.
Jake Gardner and Kimber Gardner.
Matt.
Lisa. Euthanasia, sometimes referred to as physician-assisted suicide, has been defined by the Oxford English Dictionary as the action of inducing a gentle and easy death. Other groups have defined the term in different terms, varying on their stand of the issue. The Pro-Life Alliance defines it as any action or omission intended to end the life of a patient on the grounds of his or her life is not worth living. On the other hand, the Voluntary Euthanasia Society defines it as a good death brought about by a doctor providing drugs or an injection to bring a peaceful end to the dying process. The fact that there are so many definitions of the term eludes the controversy surrounding the subject. Opponents of euthanasia insist that doctors have a moral responsibility to keep their patients alive as reflected by the Hippocratic Oath. They argue that there is a fine line between euthanasia and murder, and the legalizing of euthanasia will unfairly target the poor and disabled and create incentives for insurance companies to terminate lives in order to save money. Others, however, argue that terminally ill people should have the right to end their suffering with a quick, dignified, and compassionate death. In this speech, I will be outlining the reasons for scenarios in which I support euthanasia, as well as situations where I do not see the merit of physician-assisted suicide, or where I feel euthanasia is morally wrong. To begin, attitudes toward euthanasia have been noted since the time of ancient Greeks, before coming to Christianity. Many of the early Greeks and Romans had a fairly tolerant view of the subject of euthanasia. During the Middle Ages, Christians and views tended to oppose euthanasia. The religious views of each reinforced the views of the Hippocratic school, which forbade euthanasia. For over 700 years, English law and tradition had punished and disapproved of both suicide and assisting suicide. However, some Reformation writers in the 17th and 18th centuries began to challenge the prevailing opposition of euthanasia. For the most part, the early American colonies adapted the common law tradition that prohibited euthanasia in the American colonies. New York became the first state to outlaw assisted suicide in 1828, with others soon following suit. The American Medical Association opposed euthanasia in 1885. However, debate and controversy over the subject began to rise as America ushered into the 20th century. In 1950, Dr. Hazendale in Chicago allowed the baby to die rather than to give it possible life-saving surgery with consent of a child's parents. In the decision that rippled across the nation, Hazendale called the news conference to announce that rather than operate, he would merely stand by passively and let nature complete its bungled job. By declining the operate, Hazendale got more Americans than ever before talking about euthanasia. The turbulent 1930s saw a rise in public support for euthanasia in the United States. Public opinion polls indicated that almost half of Americans believed that passive mercy killing was permissible. The National Society for Legislation of Euthanasia was founded in the 1938s. However, when 1940s dawned, when many euthanasia movements believed it was only a matter of time before euthanasia began to legalize in the United States. World War II broke out, and the German Nazis' use of involuntary euthanasia changed the public perception. The World Medical Association condemned euthanasia in the 1950s, and public opinion polls shows declining the support for physician-assisted suicide. In the 70s, the United States Senate held the first national hearing on euthanasia. The first U.S. hospice opened, and the Supreme Court ruled that a respirator could be removed from a coma patient. 8 states enacted the right to die bills in 1977, and 1984, the American Medical Association supported withholding and withdrawing life-prolonged medical treatment in certain circumstances. By 1990, polls showed that more than half of Americans supported physician-assisted death. This was the same year that the Supreme Court ruled that a person had the right to refuse life-saving medical services. Oregon became the first state in history to pass a law permitting physician-assisted suicide in 1944. Oregon Death with Dignity Act. Dr. Jack Kevorkian, named Dr. Death, became a controversial figure in the debate of euthanasia. Convicted of murder in 1999 for his assistance in the death of Michigan man, national media attention focused of Terry Schiavio when her feeding tube was removed after a long court battle. The debate continues to rage over the controversy surrounding euthanasia and will continue on in well-heated battle. Next, there are various forms of euthanasia to be aware of, each of which brings a different set of rights and wrongs. Euthanasia can be classified in active euthanasia and passive euthanasia. In active euthanasia, a person directly and deliberately causes the patient's death. In passive euthanasia, the physician does not take the patient's life. They simply allow them to die. Rather than giving the patient something to cause their death, passive euthanasia is when death is brought about by an omission, or when someone lets the person die, generally done through withdrawing and withholding treatment. Traditionally, passive euthanasia is thought of in less of a negative connection than active euthanasia. There is also a distinction between voluntary, non-voluntary, and involuntary. Voluntary euthanasia occurs at the request of the person who dies, and non-voluntary euthanasia occurs when a person is unconscious or unaware and is unable to make the decision. An appropriate person takes the decision on their behalf. Involuntary euthanasia occurs when the person who dies chooses life and is killed anyway. Involuntary euthanasia is widely opposed and is regarded as a crime in legal jurisdictions, and is sometimes used for reason in not changing laws relating the other's form of euthanasia. Now that the various types of euthanasia have been distinguished, there are various pros and cons to having long been debated on the controversial topic. With regards to passive euthanasia, if a patient is suffering at the end of his or her life, choosing to stop or withhold life-sustaining treatment sometimes ends the patient's life of suffering more quickly and effectively than withdrawing or withholding treatment. Once death has been accepted, it is often more human to end a life quickly and peacefully when that is what a patient wants. Ultimately, it is the right of a competent, terminally ill person to avoid executing pain and embrace a timely and defiant, dignified death if they so wish. As a future nurse, I will be taking a Hippocratic oath, promise to help save the lives of future patients at the best of my ability. I will neither give a deadly drug to anybody if asked, nor will I make a suggestion to this effect. The question becomes, when do we stop doing all that we can do? When do we withhold which therapies and allow nature to take its course? When we are allowing wondrous medical methods to prolong the dying rather than living? These questions will continue to debate in the coming years, with arguments on both sides of the issue.